This is Tanisha with Black Med. We've been talking with Dr. Walker about the seventh leading cause of death in the United States, diabetes. Last episode, we covered the general overview of diabetes. Today, we're going to discuss the effects and the complications of diabetes. So, Dr. Walker, let's talk about the biggest complication that comes with diabetes.
Well, I'm not going to say it's the biggest one, but there are a lot of complications with diabetes. We mentioned in the segment before that many patients are concerned about their numbers and where they are at present. But we know with diabetes, we have what we call end organ damage. And that's where the diabetes is uncontrolled and then it starts to affect every area of the body. One of the biggest ones that we see is neuropathy. Neuropathy is the affecting of the nerves. So by the time a patient comes and is diagnosed with diabetes, many times they already have one of the complications. So if the patient comes in and says, well, something is wrong because I'm feeling tingling in my hands or my feet, that patient has already started to experience what we call diabetic neuropathy. So that's one of the complications. Another complication is what we call retinopathy. That's where diabetes starts to affect the eyes. And interesting enough, greater than 50% of diabetic African American patients will have retinopathy.
Wow.
Yes, and some other things that affect the eyes that are not necessarily caused by diabetes, but we find that in diabetic patients, they have a greater amount of glaucoma, they have a greater amount of cataracts. Okay, another common complication of diabetes is what we call nephropathy. That's affecting the kidneys. Diabetic patients, because of their uncontrolled diabetes, will start to affect the kidneys. One of the things that I always talk to my patients about is that the kidney, God made it to be a perfect filter.
Okay.
It's a perfect filter. It should filter everything out of the blood. So when urine comes out, urine should almost be pure. But when diabetes starts to affect the kidney becomes less of a filter, so you start getting things like proteins and things that start to seep out in the urine, and that affects the kidneys. So you have a lot of diabetic complications. That's why it's so important to take care of diabetes once it's diagnosed and not for the patient to pursue or going into some of the diabetic complications.
Okay. And I'm sure you see a lot of those complications in San Antonio in our community. Let's talk about that. How does it affect the patient?
In San Antonio, in my practice in San Antonio probably, we know that there's about 65%, I hope I'm quoting this right, about 65% Hispanic population, about 8% African American. The population that has the greatest effect by diabetes is African Americans, Latino Americans, Pacific Islanders, and Asian Americans. So when you think about that, those are the greatest populations that are affected, then, we're going to see more in San Antonio. And likewise, I see the same amount in my practice.
Okay. How can we prevent some of the diseases for a person with diabetes?
Well, if you think about what the risk factors are, we talked about it earlier that one of the greatest risk factors is obesity. So if obesity is a risk factor for diabetes, then it would be reasonable that if you would lose weight, that would cause you to have less of a chance of developing some of the diabetic complications. The other thing is controlling blood pressure, cholesterol. It has been found that if a patient keeps their blood pressure to less than 130/80, they have less likely a chance of developing what we call diabetic-related heart disease, because diabetes and heart disease are directly related to each other. Yes.
That is great information. I know all of you folks are really enjoying this conversation we're having with Dr. Walker. This is Tanisha with Black Med, wishing you great future, heritage, and health.